I definitely play it off as not a big deal. I think most other people with CF do. It's just one of those things that I've gotten so used to that I don't think it's a big deal in my life, but I think I would want people to know just how hard it is. My name is Molly Pan. I'm a senior at Stanford right now. I was diagnosed with cystic fibrosis when I was 10 years old. I had no clue what in the world the word they had just told me. I don't think any 10-year-old could tell you what cystic fibrosis is unless they actually have it. All I knew was that I suddenly had an hour and a half's worth of medications to do in the morning. My parents were treating me different. My mom was crying all the time. That was the biggest difference, being told from everyone in my life that I was now different and not really understanding why.
Cystic fibrosis is essentially a genetic lung disease, and it affects a certain protein that patients are unable to regulate chloride or imbalances in their system. And as a result of that, we have disturbances, particularly in the lung system, which accumulates a lot of mucus that we can't get rid of. It also affects the pancreas, the liver, the reproductive system, the gut system, as well as the sinuses. So it's a multi-system problem that these patients tend to have.
In 6th grade, we had to do these disease reports for our biology class, and I chose to do mine on CF, and I knew everything, like sort of the conceptual, it's a fatal disease, all of that stuff. But it was really the first time that I had done my own research into it, and it really hit me just how serious it was. At that point, the median age of survival was still 28 years old. It's now up to 36 or 37. So hopefully as I get older, the age will keep going up. But that, I think, was really a shock when I was 12 to say, wow, I am almost halfway done with my life right now.
Since her diagnosis at Stanford at the age of 10, Molly has had a rocky course. In her early teens, she developed a significant inflammatory component of her lung. We had a couple of years of really having a deterioration of her lung. Over the last 5 years, which I've been caring for Molly, we've had some great stability in her lung disease. In fact, I think that it's been settled a little bit. It is very difficult to prognosticate on what her longevity will be. We hope that based on the literature, she will live well into her 40s, possibly 50s. And as time goes on, these numbers may actually change if we have better development of therapies. And that's my hope.
One of the most important things that's happened to our program recently is we've been able to develop an adult cystic fibrosis clinic here at Stanford so that the adult patients, instead of having to be seen at the Packard facility, are now seen at Stanford, where we have our multidisciplinary team in place.
The blessing and the curse of being diagnosed late is I had a normal childhood. I was a very sickly normal child, but I didn't have to do meds. I knew what it was like to be treated as a normal person and not as someone with a fatal disease.
It's a big basket of medications that she does. Generally, what Molly will be doing is using an inhaled bronchodilator. And what the function of this does is basically to relax the airways. The other aerosolized solution she's doing is pulmozyme. And the function of the pulmozyme is to break down DNA and allows to clear the lung. The other therapy is inhaled hypertonic solution that comes into the lungs and basically helps to break down the mucus and also triggers a cough reflex and allows her to cough. Following that, she will do airway clearance. Molly uses the vest, and the vest basically pounds on the chest throughout. Now the function of the vest is to kind of percuss or massage the lungs to allow the adherent mucus to release and enable her to cough this up. This routine will be continued 2 to 3 times a day. In addition to all of that, Molly has to do her exercise routine to also help with her airway clearance. And then lastly, there's a whole bag of medications that she takes.
This is going to sound really cliche, but they always talk about in CF, quality of life over quantity of life. And I will gladly trade a week going down the Grand Canyon for 3 weeks in the hospital, just to have that one amazing experience with my family. Just these once-in-a-lifetime opportunities, to me, are more important than doing my meds every single day, just living in the routine, trying to live as long as possible.
You can be happy and be happy every day and understand you have a disease beside you. Molly has mastered that, and she knows how to have a great quality of life. CF does not have to dominate your life in any way. It can slow it down a little bit because there are a lot more therapies that one needs to do. But if Molly's a prime example, you can have a disease, but you can also have the rest of your life in full form. So, that's something I commend her on every single time she comes in.